Governments have given drug companies billions of dollars to develop a COVID-19 vaccine. Yet, millions of people won't be able to access or afford the vaccine because these same companies have complete control over the price. We need a vaccine that's free and available to everyone, everywhere. Where you were born and how much money you have shouldn't determine whether you live or die. It's time for a people's vaccine.
Hello and welcome to this virtual event on a people's COVID-19 vaccine. I'm Milan Verveer and I direct the Georgetown Institute for Women, Peace and Security. We are so pleased to be hosting this program today with Oxfam America. As we all know, COVID has exposed deep inequities on people around the globe, and it continues to take a terrible toll. No one will be safe from the effects of the pandemic until everyone is safe, until everyone is vaccinated. A people's vaccine, one made available to everyone, no matter where he or she lives, no matter rich or poor. It is urgently needed. And we are still far from having that global commitment that is required to meet the need. In other words, the world today does not yet have what it takes to end the pandemic, to get everyone vaccinated. We have an exceptional group of experts and committed leaders with us today to discuss this topic. Each has been at the forefront of the effort to ensure an equitable vaccine distribution. They will share their views with us on what needs to be done urgently and why it needs to be done. As our first speaker today has written, until the whole world is vaccinated, the whole world will be at risk. The longer the world lets the virus run free to infect and mutate, the more likely the world will face a prolonged crisis. And none of us wants to see this happen. We are in a race against the COVID-19 virus, and the virus will continue to win unless we act decisively. Before we begin, I'm happy to welcome close to 800 attendees who are with us from across 100 countries. And we anticipate another couple thousand who are with us on Facebook. We have already received many pre-submitted questions from our audience. We also ask you that if you wish to submit questions during the course of this discussion, you are welcome to do so using the Q&A feature on your screen. Just note your name, affiliation, and to whom you are directing your question. I can think of no better person to start this conversation than Dr. Raj Shah, the president of the Rockefeller Foundation, where he has been leading its innovative, deep and lasting commitment to fight COVID-19. He previously served as the administrator of the United States Agency for International Development, where he led the US response to the Ebola pandemic, the Food Security Initiative to fight against hunger around the world, significant investments in health, the response to natural disasters like the earthquake in Haiti, and so much more. He also has deep experience as a scientist and as a physician. And he served as the Undersecretary of the Department of Agriculture, where he created the National Institute for Food and Agriculture, and many positions in the Gates Foundation earlier. There's too much more to say about him, but I would be remiss if I didn't also note that he is was a distinguished fellow at residence at Georgetown University. Raj, thank you so much for being with us today. It is really a sign, I think, of your ongoing commitment to this issue. You wrote recently in Fortune, until the whole world is vaccinated, the whole world will be at risk. Please help us set the context for this discussion today. Why is this issue so urgent? What can we be doing, each of us, to really push this envelope in a way that will help us get to our goal? Thank you so much, Dr. Shah. The floor is yours.
Well, thank you, Milan. It's so wonderful to be with you, and I appreciate the opportunity to speak to this incredible assembled group. As you know, I'm a big fan of the Georgetown Institute for Women, Peace, and Security and your extraordinary leadership of it. And I also want to thank our colleagues at Oxfam who've done such important work to make it clear that, in fact, until we vaccinate the entire planet, none of us are safe from COVID and COVID-19 and its variants. And in fact, none of us have achieved the equity objectives we all seek as we try to recover from this tremendous catastrophe. The reality is we know the current situation is unsustainable. And if I just step back and point out, there have obviously been millions of deaths from COVID-19 around the world. And we know that a disproportionate of those percentage of those deaths have been actually in wealthier nations that have had certain pre-existing exposures so far. But now we see a big acceleration in mortality and morbidity related to COVID-19 in India, in Brazil, in so many parts of the emerging world. And that makes this crisis even more urgent. We've been successful at building a big global public-private partnership that has resulted in tremendous breakthroughs of science and innovation. And we now have an entire portfolio of safe and effective vaccines, with several more on the way. What we now need to do is understand that in order to deploy these vaccines effectively, every community has to reach a target number well north of 70% in order to achieve real herd immunity everywhere. And until that is achieved, no one is going to be safe. The reason is, if we have large pools of viral replication in the developing and emerging world, even if we're all vaccinated in wealthier nations, those pools of viral replication will give rise to new variants. And we already see a range of new variants reducing the margin that the existing vaccines have had in terms of the strength of their antibody response. And so it's entirely possible that new variants of the future will undermine the effectiveness of current vaccines and require societies that think they've gotten over COVID to once again deal with an out of control pandemic. And so what can we do about it? Well, we know the basic solutions are pretty straightforward. We need a massive new investment in global immunization and global health. The Rockefeller Foundation, together with the International Monetary Fund and many, many other partners, has proposed that a new allocation of International Monetary Fund special drawing rights, effectively a reserve currency, be allocated and then used in part to invest in a massive new effort to immunize everyone everywhere. Such a proposal could generate $40 or $50 billion over the next 2 years and could help accelerate the achievement of herd immunization everywhere on the planet by the end of next year. Second, we need to turn additional public resources into vaccines that are available and accessible everywhere. And that's going to require a different way of thinking about how we manufacture and distribute these vaccines. The reality is production has largely been absorbed by the wealthiest nations to date. That's not unexpected, but we now need to change that and make sure it's much more accessible to others. So I welcome the conversation on intellectual property. We know that intellectual property alone doesn't yield vaccines that go into people's arms. You need technology transfer, support for productive and new production facilities. You need to use advanced purchase commitments everywhere around the planet to make sure vaccines are available. And ultimately, you need big investment from public health agencies to ensure adequate distribution so that you actually get the coverage you need, particularly in hard to reach and lower income communities in every society. That package of actions has been pursued before. In 2000, after the creation of the Global Alliance for Vaccines and Immunization, we saw a steady 20-year increase in vaccination for children because of people coming together, public and private, corporate and public health, to figure out how we make sure every child is fully immunized. We did this during the Ebola crisis, where we recognized that addressing the pandemic crisis in its hotspot, in that case in West Africa, would protect the rest of the planet. And so the world made the right investments to do just that. This is our moment to make sure we grab a hold of COVID-19, see it as what it is, which is that we are all in this together, and make the sort of massive one-time but absolutely necessary investments in both manufacturing and distribution and access of new vaccines, so that we can achieve the herd immunity target in every community on the planet. It's achievable. It's incredibly affordable in a world where we spend trillions of dollars dealing with the consequences of a pandemic. And in fact, it's the only way to protect even our very own societies in the United States or other OECD countries that seem to be on a more robust pathway to achieve herd immunity via vaccination. So I appreciate the chance to be with you. I'm thrilled that you're going to have a real dialogue about what it takes to achieve this goal. And I know that with you and your community of partners, we'll all be successful together.
Well, thank you so much, Raj. Thank you for taking the time, for your ongoing leadership. And as you so eloquently said, this is our moment and we're all in this together. So we will now proceed with our distinguished panel. And we're going to begin with Chelsea Clinton, who is the vice chair of the Clinton Foundation, where she's been working to promote vaccine access, in addition to holding a wide portfolio consisting of efforts to create economic opportunity, improve public health, civic engagement, and in so many other areas where she has been such a demonstrated leader. Chelsea serves on the boards of the Clinton Health Access Initiative and the Alliance for a Healthier Generation. She teaches at Columbia University's Mailman School of Public Health and has written several books for young readers. Chelsea, it's awfully good to see you today. And we're thrilled to have you join this discussion and hopefully pick up where Raj has left off. And let me ask at the outset, because you have been such an outspoken leader about the need for equitable vaccine access. How do we move forward in your judgment and drive confidence in the vaccine? Because that's still a big question for so many and a big problem, obviously. And why is an equitable vaccine distribution important? And for a moment, let's look at our country. Why should the United States care about this?
Yeah,
so we're eager to hear from you.
Thank you so much, Milan. And I really want to thank everyone at Georgetown for convening us and everyone at Oxfam America for helping bring us together in a virtual space, but kind of very real community this morning. And I really, I want to build on kind of what Raj was saying, and then kind of also kind of comment on our deeply inequitable vaccine and vaccination kind of efforts here in the United States thus far. So, at a global level, as Raj was saying, it's not only that, a majority of the COVID-19 vaccinations thus far have been distributed in wealthy countries. It's actually more than 86%. So it's, well north of just a bare majority, and only 0.1% have been given in low-income countries. So the inequity is vast and kind of in and of itself should be a moral calling for remedy. But as Raj was saying, we are continually reminded of how deeply interconnected we are, especially when it comes to public health. And so this very much is in our best interest to follow the leadership of the Rockefeller Foundation and kind of what they're working to do with the IMF. I also strongly support the push from Mary Robinson and others of our kind of so-called elders, kind of very long-time public servants from across the globe who are calling on the WTO to effectively waive the intellectual property rights. This is especially important for the mRNA vaccines, which are relatively easier to produce. And yet, of course, kind of as Raj said, sharing the intellectual property in and of itself, while necessary, is insufficient to actually ensure that vaccines are produced around the globe, and then those vaccines, as now we say colloquially here in the US, kind of turn into shots in arms. And so we know that while that is a crucial step, we also, I think, from the US perspective, should very much listen to Dr. Wafel Sadr and Peter Staley and others who've been calling on a PEPFAR, a kind of a presidential emergency program for vaccine administration, in which we would invest, Milan, in building real vaccine manufacturing capacity around the world and flexible vaccine manufacturing capacity. We know this will be important not only kind of in this moment for COVID-19, but also in continuing to inoculate people against COVID-19 into the future. We heard from the Pfizer CEO yesterday that likely we will need a booster shot, within 12 months of having our first inoculations completed. And so investing in building that flexible manufacturing capacity would be important for the now, but also important in continually protecting people from COVID-19 and from other diseases that may prove themselves to be preventable kind of with the mRNA technology. And yet I do think your questions about the United States are really important, because I think it would be kind of gross hubris if kind of we as Americans kind of sitting in DC, or I'm sitting in New York City, were to only talk about the need for global vaccine equity, as crucial and critical as that is, while ignoring the still deeply inequitous kind of vaccine rollout that we've had here in the United States. In every state, we have not had equity kind of achieved in vaccination program. In every state, we're lagging vaccination efforts of Black and Brown Americans, especially despite knowing the disproportionate burden of disease, death, mourning, loss within our Black and Latino communities. Certainly here in New York State, we had to sue the governor to force New York State to prioritize vaccinating incarcerated populations, despite incarcerated people being at a disproportionate risk for COVID. We know that a majority of the largest COVID clusters that we've had over the last 14 months have actually occurred in prison and jail settings. And so even getting to kind of risk-based vaccine distribution, as well as kind of equity-centered vaccine distribution, Milan, remains kind of a vision and not yet a reality. And yet I hope that if we continue to have more conversations like this, hopefully we won't need court cases to force our governors to make the right choices. And I certainly hope that the administration, which I do think has done a really important job, continues to prioritize equity in its vaccination plans over the months ahead.
Well, you've really continued from where Raj left off in helping us to better understand the various components of this, in addition to the urgency. And as you said, Chelsea, it's a capacity issue. It's a manufacturing issue. Distribution is critical, obviously. So is financing. And I dare say it's political will as well. And how do you see what the mobilization will take? Because you're an extraordinary advocate in your own right in the public health sphere. This is a very big challenge. What will it take to mobilize what we need to do to get to our goal? And how do we take that mobilization to scale? I love your thoughts on that.
Well, it's a number of questions, Milan. I think that events like this are really important, that we continue to kind of talk about and help each other understand, listen to one another. around kind of really narrowing in on kind of what do we need to galvanize toward. Certainly I hope that we can build political will for the US being a leader on multiple levels, a leader kind of with the Rockefeller Foundation on their work with the IMF. I hope that the US, they've indicated they're thinking about this in the Biden administration. I hope that President Biden will support a WTO waiver. I very much hope that Americans will. We as American taxpayers invested substantially in the development of the Moderna mRNA vaccine, especially, which is a very good candidate given the temperature at which it can be stored for broader based distribution across certainly the United States as well as the world. So I hope that we here in the United States continue to take a hard look at ourselves and what we need to do on vaccine and health equity more broadly, and very much kind of take the leadership role that I think we need to claim to building the real kind of durable, flexible, but durable systems to support kind of broader vaccine distribution and kind of, again, centered on equity across the globe. I mean, at current projections, we won't inoculate most of the world kind of at the herd immunity thresholds that Raj was talking about earlier until 2024. That's a disaster. It's a disaster for people's lives and livelihoods, and it's a disaster from a kind of public health and a public health security standpoint. And so while I would hope that the kind of moral call would be sufficient, if not, I would hope that the self-interested argument would be. We've had more than 3 million people die of COVID-19, tens of millions of people pushed closer or into poverty, trillions of dollars of our economy not realized over the last 14 months. So hopefully kind of any of these statistics, as well as the human stories behind them, kind of will galvanize action, Milan. And as Raj said, I do think it's really important to recognize that, we have done big things before, whether we're talking about the childhood immunizations that Raj talked about, where we have truly saved tens of millions of kids' lives by focusing on inoculating children around the world over the last 20 plus years, whether it was the PEPFAR program started by President Bush and continued in a bipartisan way kind of across different Congresses and presidential administrations. And I also really think about the global effort to eradicate polio, which I don't think Raj talked about, launched in 1988 when the world decided that we were going to eradicate this horrific disease. In 1988, polio was still endemic in a majority of the world's countries. Thousands and thousands of children died every year. Many tens of thousands were left permanently disabled by polio infections. And we marshaled the largest kind of inoculation effort ever, kind of prior to COVID-19, to be able to kind of vaccinate all of our kids across the world. At the height of the polio vaccine efforts in India alone, we had 5 million vaccine workers who were just focused on inoculating children and babies against the polio virus. And so we know that we can do this. And so when you ask kind of how do we galvanize people, I hope that we galvanize people by making the moral case, the self-interested case, but also enabling people to imagine and understand how we can do this. And some of it might be technical and kind of what needs to happen at the IMF or what needs to happen at the WTO, but some of it also just has to happen with understanding, yes, like we can train, mobilize, deploy tens of millions of vaccine workers around the world that also would help employ, largely women who often are our frontline healthcare workers across the world, including in vaccination efforts. And we know that we can do this because we do it every year in our routine immunizations against measles and the pneumococcal virus. We also know that we can do this at large scale quickly because we did it in my lifetime not that long ago when we were kind of in the biggest push against polio.
Well, it's well said. And I think especially to think about the examples of what we have done in the past and how they can be guideposts for us. And certainly your reminder that this just isn't the right thing to do. It's the smart thing. It's the strategic thing. It's in our self-interest, and it is urgently needed now. We're going to come back to you, Chelsea, during the Q&A. And I'm going to move now to Abby Maxman, who is the president and CEO of Oxfam America, where she's been a leader on so many of the key issues that Oxfam has undertaken, from the role of gender and social change and humanitarian preparedness and response to those crises, among so many other areas of engagement. Prior to joining Oxfam America, she served as the Deputy Secretary General of CARE International, where she was posted in Geneva, and even earlier as Vice President of International Programs and Operations for CARE USA. She's had key assignments with the US Peace Corps, the UN World Food Program, the German Agency for Technical Cooperation, and others. So Abby, thank you so much, not just for your partnership today and for the work that Oxfam does, but I know that you and the organization are working on the front lines to prevent the spread of COVID. And from that perspective of frontline workers who see firsthand what's at stake, maybe you can give us a sense of why an equitable distribution of the vaccine is so critical and critical in preventing the spread of COVID, surely. And what are the stakes you see in so many countries where Oxfam overall has been working?
Well, thanks so much, Milan. And it's great to be with Chelsea, Raj, Winnie, and others speaking about this critical issue of our time. And indeed, this year has been a challenging year for all of us. But imagine coping with the pandemic while you had no access to healthcare to speak of, no way to social distance, live in a tent in a refugee camp, and imagine sharing one water tap with 250 people. As usual, in a crisis of this kind of magnitude, it is the poorest who suffer the most. There's twin crises of this pandemic: the public health emergency that has killed millions worldwide that Raj and Chelsea already spoke to, and the resulting economic fallout that's caused trillions of dollars in losses. And it's had devastating impacts on people living in poverty. You know, COVID is truly the inequality virus. And 500 million people are now underemployed or out of work, twice as many women affected as men. People are falling into debt, skipping meals, and selling their assets. Kids aren't in school. Remittance flows from migrants to families back home have collapsed. And all through this crisis, we at Oxfam have worked to help more than 14 million people across 70 countries. We've collaborated with nearly 700 local organizations, providing food assistance, distributing clean water and soap, conducting public information campaigns, and we've all seen and recognized the unbelievable suffering. But we've also seen unimaginable resilience. And this is why this pivotal moment that we find ourselves in now is so crucial. As Raj said, this is our moment. And we now have multiple safe and effective vaccines against the coronavirus. But despite investing billions of our taxpayer dollars, we find ourselves at the mercy of a handful of giant pharmaceutical corporations that do maintain monopoly control over the life-saving technologies that everyone needs. And they control how many doses are produced, where they're manufactured and sold, and at what price. And they're unable to make enough vaccines for everyone who needs them now. And this has created this vast chasm of inequality. Now, in the US, Canada, and other rich countries, someone gets vaccinated every single second. But as said earlier, the majority of the world's poorest countries have yet to administer a single dose. Now, this inequality, as Chelsea was saying, is a moral, a public health, and an economic disaster that threatens to prolong the devastation we're seeing near and far and all around the world. So rather than slicing the existing pie of vaccines ever more finely, we need to share the recipe so that we have enough for everyone. And that is why we're calling for a people's vaccine.
Abby, I think you very distinctly set out some of those barriers that are confronted and the need to overcome them. So thinking about national governments and the role that they play, the multilateral institutions, what is going to move us to action, to effective action? Because those barriers are clearly there in ways that you've articulated, and probably even others that also have to be overcome. And what are your specific recommendations to the Biden administration in terms of US leadership?
Well, thanks to truly brilliant work by scientists all over the world, as we know, we have multiple vaccines. And this is a miracle of modern science and a true testament to public investment in research and development and collaboration across national borders. Now, scientists have done their jobs. It's time for corporate leaders and policymakers now to do theirs. And even as the rollout of vaccines is increasing in some countries, we lack the political will to increase the supply and distribution of these vaccines everywhere. Now, giant pharmaceutical companies do maintain monopoly control over the COVID-19 vaccine technology that artificially constrains their supply to boost their own profit. And we see the results of that are all around us. Artificial scarcity, the cutthroat competition for available doses, this widening inequality that we've spoken about, and prolonged suffering. President Biden and other world leaders have a tremendous opportunity and responsibility to bring about this people's vaccine. The US commitments to COVAX are welcome steps, but they are woefully insufficient to address the magnitude of the challenge we face. The US and rich countries donating dollars and doses is nice, but is not the sustainable solution. And that's because sharing a dose of vaccine can only help one person, while sharing the technology and building the capacity to rapidly scale up production of vaccines and boosters now around the world will help everyone. So President Biden and his G7 counterparts should seize on this historic moment to mobilize vaccine access to all by insisting that vaccine producers share their technology and know-how and build capacity for vaccine production and distribution around the world. And this includes supporting the CTAP, the WHO's Coronavirus Technology Access Pool. We really need to encourage and not block countries' ability to produce more vaccine doses. So President Biden and G7 leaders must also support a proposal at the World Trade Organization by South Africa, India, and others to temporarily waive intellectual property rights related to COVID-19 vaccines and treatments, so as to encourage generic manufacturing in their own markets. Just yesterday, more than 170 former heads of state and government and Nobel laureates signed a public letter urging President Biden to support this proposal. We need a people's vaccine, Milan. President Biden has an opportunity to lead right now to make this vision a reality.
Well, thank you, Abby, and we'll come back during the Q&A session to hear more from you. And now to our friend, Winnie Vinyami, the Executive Director of UNAIDS and a UN Undersecretary General. Winnie leads the UN's efforts to end the AIDS epidemic. Prior to her current position, she served as the Executive Director of Oxfam International, and for over a decade, she was in Uganda's parliament, heading their first parliamentary women's caucus, I might add. She also served as UNDP's Director of Gender and Development and held countless other positions. I've known Winnie for many years, and I can attest firsthand to her passionate commitment to social justice and certainly to gender equality. So Winnie, and thank you so much for being with us today. In your current position at UNAIDS, you are more than aware of the importance of inclusive and cooperative actions on global health, and particularly for women and girls, I might add. And you've been an early champion of a people's vaccine. So from a global governance perspective, where do you think we stand right now in terms of vaccine distribution And how does it especially affect women and girls as well?
Thank you, Melan, for inviting me to join you today. Greetings from Namibia, where I am. And thanks to Georgetown Institute, to Oxfam for organizing this timely and really important panel. And I'm so delighted to be with my friend Abby and to join Chelsea Clinton. You're right, Melan, at UNAIDS, we are critically aware of the need for inclusive global health. You know, in the early years of the HIV epidemic, when life-saving treatment was available to people in the rich countries in the West, people in developing countries didn't have the opportunity for this treatment for another 8 years, 8 years of waiting. During that time, 9 million lives were needlessly lost to AIDS in the developing countries, including here in Namibia, where I am. So people in the global South were waiting because there were unjust trade rules, which maintained monopolies for companies and kept drug prices high. That was the reason. So then you say, where do we stand on vaccine distribution at a level of global governance? Well, we are not doing well at all, at all. Today, and at the risk of repeating what others have been saying, we expect that by the end of this year, 9 out of 10 people in poor countries will have missed out on a vaccine. Abby told us the pace at which people are being vaccinated in the richer countries, well, there's nothing in some poor countries. But let me also say something about the economic and social consequences of this vaccine inequity. Here's a shocking stat. The world's workers have lost $3.7 trillion in lost earnings in this crisis, while the world's billionaires have made $3.9 trillion in this crisis. So we're seeing widening inequalities in wealth, widening inequalities along gender lines in this crisis. And that means increasing poverty, and that means we are really going back on our gains, reversing our gains on the Sustainable Development Goals. This is not right. It is avoidable. Let me come to something about HIV, because we need to learn from that. We see that pandemics widen inequalities. Pandemics delay development progress. Today, the AIDS pandemic is far from over, and it is the most marginalized, those at the bottom, who remain most at risk. And I'll show how that also is the same now for COVID. Every week, Melan, approximately 5,500 young women in the age of 15 to 24 are infected with HIV every week. People we call key populations, that's LGBTQ, transgender people, sex workers, are the ones most affected by HIV. So coming to COVID, you see the same. You see that the consequences for women, poor women, those who are on the axis of inequalities, are worst. We know, for example, that the pandemic has put 20 million more secondary school girls out of school, 20 million. Many may never go back, putting them to greater risk of violence, poor health, and poverty. And because of COVID, 2.5 million more girls are at risk of child marriage in the next 5 years. I've just come back from Uganda. I found the government trying to cope with girls who are showing up for their end of year exams pregnant, very many. So we're seeing this already happening. 70% of global healthcare workforce are women. They have been on the front lines of the pandemic response from the beginning. Initially, we saw them working without even the PPE that was needed when it was scarce. Over 17,000 health workers have died in the past year. Majority are women. So the inequalities are worst for women, for girls, for especially those living in poverty, or those who may be lesbian, or those where the axes intersect is where the worst impacts are. So I am proud to lead the People's Vaccine Alliance together with Abby, calling for the vaccine to be a global public good. But we can't do it without political leadership. So we're talking to political leadership. We need the US leadership on global public health. You've said it very well. Chelsea said it very well. President George Bush initiated the fight against AIDS, the global fight against AIDS. He led. President Obama took on the world's first Ebola epidemic. President Biden could be the president that puts the world on track to end AIDS within this decade and end the COVID-19 pandemic. That would be a powerful legacy. This week in the People's Vaccine Alliance, led very much by Abby, we got 175 former heads of state, heads of government, and Nobel laureates write and sign a petition to President Biden, urging him to build on the generous and significant US commitment of $20 billion to date for COVID by supporting the TRIPS waiver at the WTO, ensuring technology transfer and investing strategically in regional vaccine manufacturing hubs. We need to think about the future. So as the presidents wrote, we need to put the collective right to safety for all ahead of the commercial monopolies of the few. We must reshape our economies, our health systems to deliver the right to health for all and tackle the deep inequalities that have been exposed and are being made worse by AIDS and COVID-19. I think it's time for America to lead. Back to you, Melan.
Well, I hear your call to action, Winnie. And as long as I've known you, you've had your calls to action and they've always been right on. And I'm really grateful for your laying out the impacts, particularly on women and girls, the most marginalized always in these situations. And like Chelsea, helping us understand, we've been at other junctures working on epidemics and found ways to prevail. And we need to do that again. Let me ask you, because you have served in your national government, you are currently at a multilateral institution, the United Nations. You've served in civil society in the NGO world. What are your specific recommendations right now? We've heard your call to action for the United States, but what else should we be doing collectively, individually, to really enhance the distribution from the terrible situation it is experiencing now to where we need to go?
Okay, several things, Melan. First, there is so much that is there that we should be building upon, as we have been discussing. From our world of HIV, and in dealing with other health crises like Ebola, huge social and physical infrastructure was put in place that today the smart countries are leveraging in order to respond to COVID. PEPFAR is one of them, is one of the supporters of this infrastructure. It's a powerful platform from which to build a global COVID response. They've put down a lot. Recently, the $250 million in extra funding the US has given to PEPFAR will help to protect the work we do on AIDS, but also undergird the work on COVID-19. because we're leveraging the same infrastructure, whether it is laboratories, which many countries are expanding to use for COVID. Epidemiologists who spent the last 30, 40 years working on HIV, and logistics experts are now retooling and working on COVID as well. Activists, the whole HIV movement that is now remobilizing and working, starting with the early phase in testing and contact tracing. We had community workers deployed in that. Now they are involved in rolling out the vaccines that are trickling in mobilizing communities, finding the people most in need, explaining and fighting vaccine hesitancy. All this work is behavior change, public safety. Communities are doing it because they know how to do it, because they've been working at the heart of HIV. So as we look to the future, pandemics are going to be coming again. So this whole infrastructure, we must find ways to build it and roll it into public health systems so that when the next one comes, we're well prepared. So that's one. At the multilateral level, many mechanisms to ensure equitable distribution are in fact there. Take the CTAP, the WHO CTAP. This is a pool that is supposed to facilitate sharing technology and licensing of intellectual property. It is based also on the medicine patent pool that was created to enhance access to HIV medicines. CTAP is there, and we're calling on all governments and pharmaceutical companies to line up behind it and use it to increase production. So that's already there. We've spoken about the waiver, the TRIPS waiver. It was always envisaged that in emergencies that there would be ways around the waivers would be brought in. So why not kick them in now? So what we need also now, in addition to that, is building the regional hubs for manufacturing. The crisis has exposed the inequalities in the production of medicines. We need to build up capacity in Africa, capacity in the Arab states, in all regions. So supporting, particularly Africa, and the efforts of the African Union to build up its capacity for manufacturing is important. That investment is important. And then I come to the issue of money, finance. I think that the multilateral system is just not doing what is needed. What it's doing is too small. It's dwarfed by the scale of the problem. What do I mean? The amount that low-income countries are expecting to receive through what has just been agreed as special drawing rights at the IMF is smaller than the external debt repayments scheduled for 2021 that will not be suspended. So what they're going to pay back is more than this, the little SDRs. On debt, it's even worse. The debt suspension initiative that was extended till the end of 2021 is not enough because private creditors who are owed so much more have just been invited to collaborate, just invited, where they may not turn up. As a result, repayments over $30 billion will flow from the poorest countries to banks, to investment funds, to rich governments and multilateral banks, from poor to rich as they struggle to survive. Only the IMF has announced a debt relief to 28 countries. So we need to have the debt canceled for 2021, 2022, and 2023 so that countries have the space to breathe, if I can call it so, to respond to a COVID crisis. So we are not doing enough in the multilateral system. We need to do more, but multilateral system is owned by governments. So again, it is governments not pulling their weight together, and we have to continue speaking and pushing. And thanks, Milan, for this platform. It's an opportunity to speak truth to power. Thank you so much.
Well, you always do, Winnie, and it is true that the multilateral system is composed of the national governments. And as you just well pointed out, this is going to take action on many levels, but it's important that we all rally to do so. Stay with us from where you are in Namibia, and we will get to the Q&A shortly. Before we do that, I want to have us hear from Congresswoman Barbara Lee. She represents the 13th District of California. But for today's purposes, really important purpose, she is a key champion in the Congress of the United States for a people's vaccine. She serves on the budget and the powerful appropriations committees, and she is the only African American woman in the Democratic leadership, serving as co-chair of policy and steering. So it's wonderful to have her join us and to hear her comments on this really critical matter. So if we can hear from Congresswoman.
Thank you, Madam Ambassador, so much for that very kind introduction. And thank you to Oxfam and the Georgetown Institute for Women, Peace, and Security for inviting me to be a part of this very important event today. And I am so proud to join an incredible group of leaders who've been in this fight for global health equity for many, many years. Joining forces with this group of individuals makes me more optimistic than ever that we can truly end this pandemic for everyone. The world needs a people's vaccine. We need to change course from the current vaccine nationalism that has plagued our response thus far. We simply cannot wait a year or two for the world to get access to the vaccines that we have now. According to the New England Journal of Medicine, current global vaccination rates won't translate to herd immunity for another 4.6 years. As you know, we all remain vulnerable unless vaccine coverage increases globally, not just in some countries, but in all countries. I am particularly concerned about populations in Africa and other low-income countries who, at a minimum, must protect their frontline health workers and most vulnerable populations, and that's at a minimum. Nations of the Caribbean, bordering the United States, and experiencing a spike in COVID infections have received little, if any, vaccine supply. Given the strong ties and frequent travel between these countries and the United States, we need to make sure that they have access to vaccines for their interests and, yes, for ours. United States leadership in the global fight against COVID-19 was late and sorely needed. While COVAX was specifically designed to address the inequality that we have seen in other global health responses, the United States did not participate until Congress provided $4 billion for COVAX through Gavi. But yes, as you know, much more remains to be done. And so I have written to Secretary Blinken, along with our chair of the Appropriations Committee, Chairwoman Rosa DeLauro, and we asked him to address 3 pathways to address the current inequities, much like your petition to President Biden. First, the United States should publicly announce a plan to share excess doses in the near term with countries they have not been able to access the vaccine. This should be done through a global mechanism such as COVAX, and we should urge other G7 nations to do likewise. Second, the United States should use every single tool at our disposal to address the supply chain that are constraining and preventing further scale-ups of vaccine production, as well as the significant investment required in healthcare workers to carry out these vaccinations. And third, the United States should incentivize pharmaceutical companies, especially ones that benefited from significant United States public investment, to enter into production agreements with manufacturers in low and middle income countries. Not only would this have the benefit of increasing supply, but would build future capacity for the next health crisis that we know will come. The United States should also clearly support TRIPS waivers of vaccine patents in times of international health emergencies at the World Trade Organization. The United States has spearheaded tremendous global health progress, first against polio and childhood diseases, and then against HIV and AIDS. We need to show similar bold and yes, decisive action to fight this pandemic. This will require treating global health as a public good that the entire world benefits from, rather than a privilege, but for those who can pay for it. I am so honored to be a part of this esteemed group, and I look forward to how we work together on this important goal. Once again, thank you so much for inviting me to join you today. And yes, please keep up the fight. Thank you again.
Well, we're grateful to have had the Congresswoman speak to us, and we value her leadership, and we will continue to need her leadership and those of others in the Congress. We're going to turn now to our audience, which has many questions, and I'm going to ask my colleague, Allie Smith, to kick us off here with a first round. Allie?
Sure, we have many questions, so I'm going to group by theme. The first here is asking, how do we best monitor where exactly the vaccines go, and how do we make sure they're getting to the most marginalized? What role must local governments play in ensuring equitable access? So if you'd like to answer, please just visibly raise your hand.
And is Chelsea back with us? There you are. Wonderful.
I'm here.
Did you hear the question?
I did.
Okay, great. Who would like to start off with this? Okay, Winnie.
It's a very important question, because not only do we have vaccine inequity that we've been discussing, we have vaccine opaqueness. There's almost total opaqueness about prices, about the contracts that are being made between manufacturers and individual countries. We find, for example, it's shocking that a country like my own, Uganda, made a deal to pay $7 per dose for the AstraZeneca vaccine, while it cost rich European countries just a little above $2 per dose. Uganda low income paying 7, Europeans paying a little over 2. Then worse still, even poorer Djibouti, we found, was going to pay $9 per dose. And at the same time, it's borrowing this money from the World Bank at an interest rate. It's not a grant. So, and it's already an indebted country. So the lack of transparency is part of the problem. We in the People's Vaccine Alliance have been calling for transparency at Gavi itself, in the deal, in the COVAX arrangements. We don't have enough transparency. The board itself ought to have representatives from civil society, from people who are affected by these illnesses that they mobilize vaccines for. They need to have more representation from people so that people can ask the right questions and get the right information. But it's a closed shop. We don't get to know, for example, when a bulk deal is struck with a manufacturer for a particular vaccine, we do not know whether the price offered is a real gain because of buying in bulk, or just a small drop, which could be made up by the quantities anyway. So we need that transparency. First of all, at the governance level of the institutions that are involved in distributing vaccines, and then with the companies that produce themselves. We need to, so we are building our voice around the question of transparency in the transactions of vaccines. Then secondly, there's the other area that lacks transparency is about the amounts as well. The African Union, for example, I hope I'm not revealing some secrets here, was trying to acquire vaccines from manufacturers directly. But then they would sign an agreement and then suddenly things are changing. But you can't know why they are changing, but there are other deals on the table with the same manufacturer. So the injustices are hidden by the opaqueness. We need the transparency. We are going to use our voice as an alliance, keep demanding for transparency and make them uncomfortable about secrecy in the transactions. That's all I can promise. We will push hard as an alliance of citizens.
Well, it's an important point, transparency. Chelsea?
Yeah, thank you so much, Milan. And I just also, I don't know if she's still with us, but I just wanted to say how grateful I've been for Congresswoman Lee's leadership on so much over so kind of many decades of tireless service, and especially her leadership on kind of the issues that we're talking about here today. I think her voice is so important and so often has been kind of a lonely one. And I'm grateful, though, that she seems to have a particularly persuasive power, as I know that more and more of her colleagues are recognizing kind of the urgency of what we're talking about here today and kind of what she is, I know, talking about so tirelessly in Congress. I certainly, strongly agree with everything that Winnie just said, and think, really the example of UNAIDS and then kind of followed by the Global Fund of including people who are affected by kind of the diseases that these instruments are set up to help prevent and treat and kind of steward responses to is so critically important, and it is something that is still critically lacking as we think about COVAX. And so just especially want to kind of add my voice to what she said there. And, Milan, I think the other part of your question or the question that was asked from the audience is how do we track the various vaccines? And yet again, I know I probably sound like a broken record here, but we know that certainly from the efforts of UNAIDS and the Global Fund around kind of PrEP to help prevent HIV, AIDS infections and antiretrovirals, whether for kids, first line or second line for adults, we do actually have very robust tracking mechanisms in low resource settings all over the world. If we think about childhood immunization, similarly, every country has some form of vaccine registry, and yes, some may have real gaps, but they do exist. And so I just think, again, it's really important that we here kind of sitting in the United States, I know, Winnie, you're not, you're in Namibia, but for those of us sitting here in the US, or kind of for the Georgetown students that are joining us, that we don't have this kind of really misplaced hubris and ignorance to think that tracking systems don't exist around the world for kind of public health programs, including vaccination efforts, even on wide scale. What we don't have enough of, though, around the world, and actually what we don't have enough of here in the United States, including here in New York City, where I'm sitting, is epidemiological surveillance. And so we do need to be investing in building capacity, especially now with COVID, to really be able to track the presence of variants, to know kind of which vaccines provide more robust or less robust protection among the variants that are already circulating, among the variants, unfortunately, that probably will continue to emerge. And so I just think we have to balance out kind of building on what already exists, respecting what already exists, and then working to really complement what already exists with kind of what needs to happen to help protect people's health all over the world and to help protect our shared global health. And it's especially important given there are now, as we've discussed, different vaccines against COVID. And so we need to know which are being given where, and then kind of how relatively effective they are in helping to protect people's health broadly and to help prevent severe illness and death.
That's another really good additional perspective on this. I think realizing we do have an infrastructure, if you will, some of it not what it needs to be, but to build on that and also the importance of tracking and all of this. Abby, you wanted to add something?
Yeah, please. Great points before. And just to emphasize what else COVID has also exposed are the deep, longstanding inequities in the public health infrastructure the world over. And these existed well before the pandemic. So we really need to do a much better job in investing in public health systems in low and middle income countries to make sure that we have the ability to administer vaccine doses now, and also so that we're prepared to respond to future public crises, like Raj and others said earlier. And this other efforts would also include regional vaccine manufacturing hubs that we can use now for COVID vaccines, but would also make the world more resilient in the future.
You know, and we have heard, I think just about from everyone, some version of learning from what we've already experienced. We seem to do that so poorly and we repeat the mistakes. And I think this whole lesson about what COVID has exposed in terms of inequities is one we're going to have to address, both in terms of the distribution and then ultimately to build back better. So let's go to another question, please.
Sure, I'm going to group two themes of questions here. The first is looking at geopolitical considerations and vaccine production and distribution, asking that there are voices arguing that the US should not lift IP protections on mRNA vaccines because it could also benefit China. Pragmatically, as a waiver on intellectual property rights, a losing argument. And then another question here on vaccine confidence and the role of pharmaceutical companies. This one's asking, what would you say to well-meaning individuals who take COVID seriously around the world, but are distrustful of the pharmaceutical companies involved in developing vaccines, some of which have been the subject of controversy? And what role should Pfizer and Moderna be doing to advance a people's vaccine? So, anyone, Abby?
Okay, we'll start with Abby.
Sure. I'll start on the geopolitical question on the first one. And you know, while it's true that the vaccine inequity we see right now has important national security implications, in addition, the public health, economic, and moral dimensions, but right now those inequities are harming U.S. interests, as low and middle income countries are actually turning to Chinese and Russian vaccines in the absence of the US approved vaccines. So removing artificial barriers to producing more doses through the TRIPS waiver that was discussed earlier on intellectual property rights would actually enhance US leadership in the world and not diminish it. And more than 100 countries support the TRIPS waiver, and the US really should join that call as a way to unite the world through a people's vaccine.
You know, I find, I just have to say it deeply challenging that we kind of would ever rely on reasoning that kind of more people in more places might benefit from more vaccinations, especially kind of from vaccines that might be more effective, as a reason to not embrace, to advocate, to support a WTO waiver, a TRIPS waiver. And so I find that quite morally repugnant, I just have to own. And yet I think there are real questions, not only kind of, again, in the context as Abby articulated, but also because we actually don't know a lot about the Chinese vaccines. You know, unlike, Sputnik 5, the Russia vaccine, where underlying data has been published, where often countries that have purchased or received the Sputnik vaccine themselves are kind of publishing kind of their population level data. We have some population level data from countries that have been using the Sinovac or the Sinopharm vaccines, but we don't actually have any efficacy data from any of the trials that were run in China, even though the Chinese vaccine trials started even before ours did here in the United States. So these are complicated questions, not only for the geopolitical reasons that were embedded in the question itself, and that I think Abby, spoke to so clearly. They're also complicated just by the juxtaposition of how much we know about not only the Moderna and the Pfizer vaccines, but also the Johnson & Johnson vaccine, what we already know about the Nova vaccine and kind of other vaccine candidates that hopefully will receive approval, provided they're proven safe and effective from European regulators or American regulators or kind of Japanese regulators or kind of other regulators around the world. We just know so much less about the Chinese vaccine. And so it is a really, I think, critical question from that perspective as well. And yet we know that none of the Chinese vaccines are mRNA vaccines. And given how much robust data we have of how disproportionately more effective the mRNA vaccines seem to be, at least thus far, against new variants that have emerged, if we were to have a WTO TRIPS waiver and Sinopharm and Sinovac and other Chinese pharmaceutical companies were able to rapidly scale up the production of mRNA vaccines to help protect people more effectively against COVID-19, whether within the borders of China or among their trading partners, like, God bless. I think that would be a great thing.
Go ahead, Winnie. Thank you.
Yeah, on this question of the vaccines and regulation, I think that we are suffering from a tension between big powers. Now I'm speaking really as someone watching it from here where I am in Geneva. I think that the Russians and the Chinese are interested in getting their vaccines approved by WHO. But it would seem that they haven't had the experience of coming before the WHO regulatory processes. They've not used it in the past. Their experience is very limited. And they've faced challenges in making the right submissions to get their vaccines cleared. It's true the Chinese were not as keen as the Russians, but they are also seeing the importance of getting a global institution, WHO, approve it so that they can market it. But I'm seeing some form of, I think they called it vaccine diplomacy, which is so unnecessary. What we want is to maximize production for the whole of safe and effective vaccines for the whole world. What we want, what we shouldn't have is power plays around the vaccines. So I would want that WHO speeds up the regulatory process for these vaccines so that we can know what is in there, how safe they are, how effective they are, and they join the pool of what everyone can get, even through COVAX. And then also there is a need for the richer countries who are used to using WHO processes, the West, to support China and Russia to be able to submit, because WHO as a regulator doesn't provide support to any country because it compromises its neutral position. They can't build capacity of any company or country. But United States could help a Chinese company, the Chinese company to apply, because this is about having capacity to make a good application and then getting your approval through. So I think it's the approval process is suffering from vaccine diplomacy, which we don't need.
So many good points. I'm very sad in a way that we have come to the end of this. We never have enough time for questions because we learn so much from our speakers, our panelists, and certainly that's been the case today. And I can't thank you enough for sharing your time, as busy as each of you is. So thank you, Abby Maxman. Thank you, Winnie Mia. Thank you, Chelsea Clinton, and to Dr. Raj Shah and Congresswoman Lee. Our great thanks to everyone who participated today. I think we've learned a great deal. We are clearly a lot smarter as a result of this discussion, and hopefully inspired to do more, each of us, wherever we find ourselves, whether we're in government, in the private sector, whether we're with NGOs or just civic advocates and activists. Everybody is needed for this effort, because we are all vulnerable and we are all in this together. And I think if we've learned anything, it is a moral necessity. It is a health imperative. It's an economic imperative. It is a matter of great urgency that none of us can afford to ignore. And I hope by virtue of today's discussion, we've not only illuminated a topic, but it has moved us to greater action. So I can't thank you enough. And to our audience, thank you so much for joining us. And the message to each of us is to do all that we can in all the ways we can, ever onward together.
Thank you so much, Milan. Thank you, everyone.
Thank you all.
Thank you all.